4 most common musculoskeletal diseases. According to statistics at hospitals, osteoarthritis tends to appear widely in all ages. Bone and joint injuries are often difficult to recover, leaving severe sequelae and greatly affecting the health and normal activities of the patient. Therefore, if we know the information about common bone and joint diseases, we will know how to prevent and reverse the harmful effects of these diseases. 1. Rheumatism. Rheumatoid arthritis is an autoimmune disease caused by chronic inflammation in the synovial fluid. Rheumatoid arthritis is easily confused with other joint diseases. This is also a very difficult disease to treat because it involves the autoimmune system, which means the body produces substances that fight against the joints and cause pain. The course of treatment for rheumatism usually lasts from 1 to 2 months to several years, sometimes requiring lifelong treatment. Rheumatism is mainly seen in women, manifested as episodes of swelling, heat, redness, and pain in many joints. In particular, the most common are the small joints in the hands, wrists, elbows, knees, ankles, toes on both sides. If the disease is not treated, the joints will quickly become deformed, ankylosing. In the late stage, the disease is common in joints such as shoulders, hips, cervical spine with symptoms such as pain and stiffness in inflamed joints, difficulty in movement in the morning, after waking up. 2. Gout. Gout is a type of arthritis quite common in our country, seen mainly in people over 40 years old and accounts for the highest rate in the elderly. Gout is divided into acute and chronic stages. The cause of the disease is a metabolic disorder, in which there is an increase in uric acid in the blood. The disease is common in men and is related to the patient's diet, such as eating too much protein, drinking too much beer, alcohol. Symptoms of gout are inflamed, swollen, hot, painful joints. In addition, an increase in uric acid in the blood will cause the formation of stones in the kidneys. Most gout patients experience a relapse within a few years, depending on their condition and lifestyle. 3. Disc herniation. A herniated disc is caused by the nucleus of a disc in the spine coming out of its normal position. The cause of disc herniation is genetic factors, wrong posture in work, movement, natural degeneration or due to accidents, spinal injuries. People with herniated discs often focus on the main types such as herniated disc in the cervical spine, herniated disc in the lumbar spine and herniated disc in dehydration. The disease causes symptoms of numbness and pain spreading from the waist down to the buttocks and legs, or pain from the neck, back of the neck, then spreading to the shoulders, spreading to the arms, hands. In addition, the disease also causes pain in the spine. Nerve pain with episodes can last 1 to 2 weeks. At first, the pain may be dull, but as time goes on, the pain becomes more and more intense. 4. Osteoarthritis. Osteoarthritis is a condition in which joint cartilage and the bone below the cartilage are damaged, accompanied by inflammatory reactions and decreased joint fluid. Age, obesity, mild or chronic injury to the joints are important factors associated with osteoarthritis. Osteoarthritis includes damage to cartilage, joints, and degeneration of the discs. The disease is characterized by cartilage degeneration and bone hypertrophy at the joint surfaces. Symptoms of knee osteoarthritis are dull pain at the junction between the two bones and stiffness, swelling in one or more joints, a crunching sound when stretching the knee joint. The more you move, the more painful it is. Increasingly painful. Osteoarthritis usually occurs in the cervical spine, lumbar spine, knee joints, hip joints, finger joints.